Damodhar Reddy, intervention cardiologist in charge of Impact Specialty Clinics. Today we are going to learn about palpitations. What are palpitations? Palpitations are abnormal awareness of their own heartbeat. What are the reasons for these palpitations and these very common symptoms what we see in the OPD setup? We'll learn about palpitations today. So palpitations can be caused by different kinds of scenarios. So basically there are two types, physiological and pathological. So physiological means these are the most commonly presenting with anxiety and panic attacks. And secondly, pathological means these are to be by a cardiologist and definitely it has to be evaluated by a cardiologist, and further we have to find therapies to monitor them and treat them. These pathological palpitations can be of different types. Most commonly come with slow heart rates, that is bradyarrhythmias, and fast heart rate, we call it as tachyarrhythmias. These can present with both structurally normal heart, that means heart can be functionally working well. In spite of that, we can have this kind of palpitation because of abnormal electrical circuits in the heart. Secondly, patients can present with structurally weak heart, or they can present with valvular problems and cardiomyopathies, so which can hamper the electrical activity in the heart, leading to palpitation. Lastly, metabolic diseases like routine reasons like hormonal disturbances like hyperthyroidism, hypothyroidism, and dyselectrolytemia like abnormal potassium, calcium, magnesium can also cause this kind of palpitation. And some of the most common presentations will be accelerated hypertension and hypertensive heart diseases, which present with palpitations and heart failure. So how we are going to evaluate this? So palpitations when they present, to be evaluated basic ECG, so that we have to find it is because of any increased in heart rate or it because of abnormal rhythm. When there is abnormal electrical rhythm, again we have to see it is because of structurally abnormal heart or it is just electrical disturbance. So nextly we have to do a basic screening of 2D echo. So with basic ECG and 2D echo, we can have an idea of what's the reason for these palpitations. Later we have to screen if at all these palpitations are coming intermittently and we are not able to do an ECG during this episode of palpitation. We have to do a test called Holter monitoring. So Holter monitoring is a basic test where we have to put a patch of Holter on the chest and we monitor continuous ECG for a period of 24 hours to 72 hours, so that if at all the patient gets palpitations during this period, we can screen and we can pick up the palpitations and abnormal ECG rhythm, so we can identify the reason for the palpitations.